Stomach cancer. Overview. The official cause of Napoleon's death was recorded as stomach cancer. This diagnosis was based on the autopsy conducted shortly after his death. Evidence. Genetic predisposition. Napoleon's father also died of stomach cancer, suggesting a possible genetic link. Autopsy findings. The autopsy revealed a large ulcer and signs of cancer in his stomach. Modern pathology tests have confirmed the presence of a tumor more than 10 centimeters long, with hardened lymph nodes around the lesion. Weight loss. Studies of Napoleon's clothing indicate significant weight loss in his final months, consistent with advanced stomach cancer. Counterpoints. Some historians argue that the symptoms and progression of his illness do not entirely match typical cases of stomach cancer. 1. Arsenic poisoning. Overview. Another popular theory is that Napoleon was poisoned with arsenic, either intentionally or accidentally. Evidence. Hair samples. High levels of arsenic were found in Napoleon's hair samples, leading some to believe he was slowly poisoned over time. Arsenic mummification. The well-preserved state of his body when exhumed in 1840 suggests arsenic poisoning, as arsenic can slow down decomposition. Counterpoints. Environmental exposure. Arsenic was commonly used in various products during that era, which could explain the elevated levels found in his hair. Chronic exposure. Studies indicate that Napoleon had high arsenic levels throughout his life, suggesting chronic exposure rather than acute poisoning. Environmental factors. Overview. The harsh conditions of Napoleon's exile on the island of St. Helena may have contributed to his deteriorating health. Evidence. Living conditions. Longwood House, where Napoleon lived, was damp, moldy, and infested with rats. These poor living conditions could have exacerbated his health issues. Toxic wallpaper. Arsenic-based pigments in the wallpaper at Longwood House could have released toxic fumes, contributing to his health problems. Counterpoints. While environmental factors likely worsened his condition, they may not fully explain the cause of his death. Prolonged intake of anti-acid treatment. Overview. Napoleon was known to suffer from stomach ailments and was treated with various medications, including anti-acid treatments. Evidence. Orgeat syrup. Napoleon consumed large quantities of orgeat syrup, which contained minor traces of cyanide. Tartar emetic. He was also given regular doses of antimony potassium tartrate, tartar emetic, a poisonous salt used to induce vomiting. This could have caused a serious potassium deficiency, leading to a potentially fatal heart condition. Counterpoints. Medical practices. The medical treatments of the time were often harsh and could have contributed to his overall decline. The true cause of Napoleon Bonaparte's death remains a topic of debate among historians and scientists. Whether it was stomach cancer, arsenic poisoning, environmental factors, or the prolonged intake of anti-acid treatments, each scenario offers a fascinating glimpse into the final chapter of his extraordinary life. What do you think caused Napoleon's death? Let us know in the comments below. Duker.